Hey friends, welcome back to my YouTube channel, Guiding You Through Breast Cancer. I'm excited to share a special guest with you today. We're going to be chatting about acupuncture and how it can help during your breast cancer treatment and what is acupuncture actually. So like this video right now if you're excited to hear about that, and subscribe. And let's go ahead and jump right into the interview. I have a very special guest today. She has become a great friend of mine, and she is my acupuncturist, and she's also an oncologist, Dr. Laura Bowman. So she's going to share with us some wonderful information about acupuncture and how it can benefit you during your breast cancer treatment. So welcome, Dr. Bowman, and I would love to start out for you telling us exactly what is acupuncture and how does it work? Why do I love it so much?
Well, acupuncture is actually the origins of it are about 3,000 years ago in terms of the origins of Chinese medicine and finding the acupuncture points. And of course, it's not the same as it was 3,000 years ago, but so it's evolved since then. But the points are the same, and what they are is they're places on the body where communication junctions come close to the surface, and those communication junctions include blood vessels, nerves, lymphatics, and places where muscle groups and fascial planes meet. That's how the body talks to itself. So the acupuncture needles aren't really needles. They're thin filaments of metal that are very, very thin. They're hair-like. And the purpose of them is just to slide into the acupuncture point. And what it does in the acupuncture point, point by point, is it changes all the communications. And it changes them in ways that they've learned about over the last 3,000 years. And they're patterns that you use for certain conditions, for pain, for sleep, for insomnia, that have evolved over time. And so it's good for all kinds of things, and can be very directed for specific things and for specific times in terms of breast cancer therapy.
What benefits for someone that has been first diagnosed with breast cancer or they're going through treatment? Like, what are the immediate benefits? Like, I know how it gave me energy and helped with fatigue, and it helped some with nausea, but tell us like more in depth about why someone with breast cancer might consider doing acupuncture.
So acupuncture is good wellness treatment even if you don't have breast cancer, because it helps with your immune system. It helps lower your stress levels, and it lowers the sympathetic nervous system, so the adrenaline hormones. It helps lower that stress response. And so one of the first things is when you have a breast cancer diagnosis, that's a stressor all by itself. And so it's a trauma. And so acupuncture is good for that trauma and that stress in terms of bringing down the stress hormone levels and helping with the body's response to that trauma. Now, then during breast cancer treatment, the phases of treatments, it helps in those general ways in the background, but like for instance, specifically after surgery, it's very good for post-surgical pain. And I've treated a lot of women going through radiation for breast cancer. And that treatment, you do it weekly during radiation, and it helps prevent the fatigue that happens in about week 5 or someplace between week 3 and week 5 of radiation for breast cancer, even in women that don't get chemotherapy. And so it really, really helps with that, and it also helps decrease some of the skin changes that happen with radiation. Then during chemotherapy, it's very good for nausea. It helps with the immune system. It helps keep the chemotherapy on time. And one of the things we know about breast cancer therapy and any kind of chemotherapy for cancer is that the closer you are to getting your treatment on time, the better the chances of keeping the cancer away. And so, that's an important component of getting acupuncture during your chemotherapy. And I recommend it weekly during chemotherapy as well. Then many women, after they've completed chemotherapy and radiotherapy for breast cancer, are treated for between 5 and 10 years with either Arimidex or letrozole or tamoxifen or one of the estrogen blocking treatments. Those treatments have their own bag of side effects that includes insomnia, depression, muscle aches and pains, problems with sleep, and hot flashes. And acupuncture has been shown in several studies to help. And as a matter of fact, they did a randomized study in a big multi-center randomized study in women with low-stage breast cancer, where they did acupuncture once a month in one group, and then of course the other group got placebo. In other words, just usual support, which is usually nothing. And so they really showed with a good quality of life metric that the acupuncture helped control all those symptoms: the insomnia, the depression, the muscle aches and pains, and the fatigue. Um, and so the interesting sideline of that study is that the women that got acupuncture also had a lower relapse rate. So there were lots of reasons to do it. And I treat a lot of women that are ongoing on treatment. They say the acupuncture lasts about 3.5 weeks. So if they're coming once a month, they're 3 or 4 days, they feel bad. So a lot of them come in 3 weeks instead. So.
Okay, that's great to know. And something that I've experienced that I would love for you to elaborate on, when sometimes you're inserting the acupuncture needle, you'll feel energy, or I think you've mentioned the chi. Will you elaborate on that a little?
So sure, the acupuncture points, as I said, they're junctions where there are nerves and blood vessels and lymphatics, and also where muscle groups meet. And the fascia that covers the muscle is a big part of our body's communication network. And so that's all in there. The other thing that's in there are little muscle fibers that are part of the little network of the communication junction. And what they do is when you put the acupuncture needle in, as it goes right into the center of the point, the muscles grab it, and it's called du chi in French, the arrival of chi. And so it's basically the energy of the acupuncture point and the reaction of that point to having the needle there. And then again, as the needle sits there, that feeling, first of all, just lasts for a second. It's a flash of pain. So I treat children with a lot of conditions as well, and the kids I treat will say, "Oh, you got it," and then that's it. It's gone. And so it's if you get very much acupuncture, as you know, Cari, when you get that feeling, it's kind of like oh, it hurts so good, because you know you're in the right place then. And then a lot of times, depending on what your body awareness is, you'll actually feel things kind of moving while they're in, because the way that acupuncture really works is to move energy through the meridians. And the meridians are a geographic connect the dot by function of acupuncture points. So one point along the stream works in the same methods or toward the same parts of the body as the one before it. And so you're moving acupuncture through those meridians, or moving energy through the meridians with acupuncture. And so one of the things they say is that dysfunction, pain, or other problems within the meridian are a cause of their energy blockage. And so the purpose of the acupuncture is to move the energy around the blockages. And so that's part of the principle involved with the Chinese medicine part.
I love it. It's so interesting. And I've definitely experienced, have been coming to see you for well over a year now. And some of my most creative ideas have come when I'm on the acupuncture table. The most zen-like feeling, it's undescribable, but I can tell instantly how it's changing my body for I can feel it. It's just so interesting to me. It really is. Right. So I'm so thankful that I tried it.
Yeah. Well, one of the interesting things about it in terms of feeling zen and feeling in a better space is it actually changes your neurotransmitters. It changes your dopamine levels. It changes your serotonin and your melatonin. And so it does help you with sleep. It causes endorphin release. So you feel like you've gone for a run, even when you haven't, after the acupuncture, because it gives you the equivalent of a runner's high without ever leaving the table.
Yeah.
Yeah.
Acupuncture high. Yeah, I feel it. It's amazing. Oh, and the one thing I wanted to make sure I brought up, because I didn't know this when I started chemotherapy. So there's a certain time that you recommended to me after my chemo treatment. The first time I came to you, or it was right before I started chemo, and I didn't know anything about the what is the shot? I just forgot the name of it. The Neulasta shot.
Uh-huh.
So, and then you mentioned to me it's good to come after that, right?
Sure. And of course, the Neulasta shot after, which is given after the chemotherapy to bring the blood count up, it does that and it helps prevent infections. It's a great thing. But it causes bone pain and muscle aches, and sometimes it even causes fever. And so to come, shortly after that Neulasta shot, in terms of the timing after the chemotherapy, is a good thing to do because the acupuncture really helps ameliorate the side effects of the Neulasta shot as well as everything else. So yeah, for sure.
Yes, and I did find that to be very helpful. So my second round of chemo, I made sure I made my appointment after the new Lasta shot to help with those.
Right,
Um,
right, for sure.
so great. Well, thank you so much for taking time to educate us on what acupuncture is and how it's going to benefit someone going through breast cancer treatment and also after their treatment, especially for the immunity reasons. And that's why I'm
Mm,
continuing to come see you for acupuncture.
wonderful. And it's a good thing all around in terms of the monthly contact too. You develop friendships with people, and that therapeutic relationship is important as well. I think when you're taking care of the whole patient, that part of it is really important. So thanks for coming.
Yes, you're welcome. Yeah, the whole mind, body, everything. And I'm gonna put Metro Acupuncture in the description below in the YouTube channel, so you'll be able to book your
Okay,
with Dr. Bowman and also Mark, who owns Metro Acupuncture. So thank you so
wonderful,
much, and I will
great.
see you soon. That interview just warms my heart. Dr. Bowman is such a healer, and I'm so thankful that I began my acupuncture journey with her during my breast cancer treatment, and I continue to go after. Like I said, it's been a huge part of healing for me. So thank you for watching, and subscribe, like this video if you haven't already. And I would love for you to comment below. Let me know if you have been going to acupuncture during your breast cancer treatment, or if you went to acupuncture before you were ever diagnosed with breast cancer. I want to hear your experiences. And do you have other questions about acupuncture and breast cancer? If so, comment below and we can make another video. All right, everybody, I'll see you soon.